In this video, we'll be covering Part 1 of Chapter 3, Clinical and Counseling Psychology for PSY 120, Careers in Psychology, Neuroscience, and Human Development. In the areas of clinical and counseling psychology, what we do know from the statistics is a little over half of people who pursue a doctoral degree in some area of psychology are in the areas of clinical counseling and school psychology, which we're going to look at school psychology in the next chapter. What that shows is that there is a significant proportion, at least at that higher graduate level, who are pursuing those advanced degrees in areas that are applied. So by applied, we mean that you're working in a space where you're providing care, clinical care, counseling care, assessment care, and so on, to people in need. Being a mental health service provider, regardless of whether it's clinical, counseling, school, or we could include areas like social work, it gives students the chance to get specialized skills and to learn the theory and knowledge base that can help people who are experiencing mental illness, people who are experiencing other kinds of emotional challenges, and otherwise are in psychological distress. I know a lot of my students who come in and become my advisees, the majority of them are entering into a psychology major or related major thinking they would like to be able to help people. And that's true regardless of whether their major is psychology, neuroscience, or human development. Most of them are looking for an applied specialization of some kind. Looking at clinical and counseling kind of together, we need to explore some of their similarities but also identify differences. This is a challenge for students. They often think that clinical and counseling psychology are exactly the same thing. They're not, but there are many overlaps which can make it confusing from a student perspective to sort things out. So both clinical and counseling psychology involve working to help people alleviate distress of some kind. So whether they're experiencing depression or anxiety or post-traumatic stress or substance abuse, whatever it is, the practice is directed at doing assessments, determining exactly what's going on with the person. It may include diagnostics. It may include very specific forms of treatment and therapy. Both clinical and counseling psychologists can engage in consultation, and people who have degrees in both areas can be researchers and academics, as well as mental health care providers. So looking specifically at clinical psychology, and historically, clinical psychology has been much more strongly aligned with psychology and psychiatry as professional areas. Clinical psychology focuses on, the science, the theory, the practice, of really kind of digging it down into what is it that causes people to develop certain patterns of mental illness. What are the causes? What are the traits? What are the symptoms? How do we do diagnoses? How do we classify diagnostic categories and use those to design treatment approaches for people who are currently in distress? Historically, clinical psychologists have tended to operate more in a medical model, meaning that there's a tendency, and I'm choosing my words very carefully here, there's a tendency to operate in this space of really focusing in on illness as opposed to health. So you're looking at, let's say you have a person who comes into the hospital setting and is showing signs of hallucinations and delusions. The clinical psychologist may be called upon to assess the person, determine whether or not those hallucinations and delusions are arising from a psychiatric condition, or is it caused by some other illness or consumption of illicit drugs, for example. So the clinical psychologist is going to tend to come at issues from more of a medical perspective. So as a result, clinical psychologists do tend to work with people who have more serious mental health problems. That's not always the case, but it tends in that direction. Clinical psychologists are going to be trained to do assessment and diagnostic work, to provide interventions and treatments, to do consultation and research. Counseling psychology historically arose separate from clinical psychology, although there are some overlapping pathways. Counseling psychology really kind of set itself apart from traditional clinical psychology and psychiatry by moving really strongly away from psychoanalytic models of thinking about caring for people who are in emotional distress. Counseling, especially if you go back historically and you look at people like Carl Rogers, they really wanted to focus on human improvement. So enhancing what people already possess in terms of their skills and abilities, helping people to grow, helping them to change and move in directions that they want to by taking advantage of their current abilities, their current strengths, and so on. Counseling psychologists, like clinicians, are going to deal with emotional and behavioral difficulties. On average, they tend to be somewhat less severe. So whereas your clinical psychologist is going to be working with people with, say, schizophrenia, bipolar disorder, PTSD, eating disorders, severe clinical depression, and so on, counseling psychologists are going to work more with people who are less severely affected. So typically they're not going to be providing counseling services to people who are actively psychotic, for example. That would be more in the domain of the clinical psychologist. They also tend to use somewhat different techniques because they are focusing more on helping people improve their well-being as they grow and change across the lifespan. And this can include a range of services that they may offer. In addition to traditional psychotherapy, they may also be providing vocational advice, like career-related advice, health-related advice, and so on. The counseling psychologists have been, and again, this is going back historically, when counseling psychologists really kind of identified themselves as distinct from clinicians and from psychiatrists, they really wanted to underscore this philosophy of understanding and appreciating human diversity and treating people as central to the process of counseling. So, counselors like Carl Rogers, who founded person-centered therapy, really kind of dug their heels in on this issue that when you're working with people to improve their lives, you need to put them in the driver's seat. Clinical psychology historically has tended to put the clinician in the driver's seat. Now, as history has unfolded, the similarities between clinical and counseling psychology have grown, and the differences between them have decreased over time. Let's look at some of the differences between these two approaches. As I mentioned before, clinical psychology is a bit more medical model based, meaning you're going to start with assessing and describing a set of symptoms and characteristics. You use that assessment to provide a diagnosis, and then using that diagnosis, you come up with a treatment plan designed to reduce those symptoms that are interfering with adaptive functioning. Counseling psychologists tend to be less focused on pathology, and they tend to be a bit more holistic in their approach, looking at capitalizing on their clients' strengths in order to minimize the negative impacts of some things like say, anxiety and depression, in order to minimize that, you're taking advantage of the client's own strengths. You take into consideration various aspects of the client's life to help them be empowered to move forward in a more holistic sense. Clinical psychologists in that context, in the context of this set of similarities and differences, they're going to be a little more likely to be working in concert with medical professionals, such as psychiatrists and other kinds of medical doctors. Counselors, not as much. Counseling psychologists are more likely than clinicians to be involved in career counseling. Clinical psychologists are going to be much more focused on assessment and diagnostics. Even today, they're a little more likely to be trained in techniques called projective testing. Part of that is sort of historically connected to the psychoanalytic theoretical perspective that kind of gave rise to psychiatry, but by extension gave rise to clinical psychology. Clinical psychologists are going to tend to lean more strongly in the direction, and I'm choosing my words carefully again, tend to lean. It may or may not be the case for any individual that you run into, but on average, clinical psychologists are going to be a bit more likely to be behaviorally focused and or psychodynamically focused. So a little more of that Freudian psychology, a little more of the behavioral approach to behavior change. Counseling psychologists, in contrast, are more likely to be trained in humanistic orientations, such as that proposed by Carl Rogers or Abraham Maslow, and many of the students who followed them. So philosophically different. The conversation I have with students who are like, I don't know whether clinical or counseling is best for me. And to make it even more confusing, if students are looking at master's programs, there are now master's programs in clinical counseling. So the hybridization movement is afoot. When I meet with students one-on-one and talk about their plans, I try to ground them in this conversation about what are your values and how do your values fit with the career that you're looking at. Now, some similarities often come in the form of the types of research questions that people ask. I'm not going to read through all of these. You can read them on your own. But generally, both clinicians and counselors are really invested in discovering effective treatments for problems that are very common, like anxiety and depression and substance use issues. They're all both interested in understanding self-injury and suicidality. They're both invested in outcome research on the effectiveness of psychotherapy, like is psychotherapy as effective as other approaches? Both are interested in enhancing the quality of the doctor-patient, doctor-client relationship, and so on. Both clinicians and counselors today, so not in the way back history when both fields kind of splintered off and created their separate identities, but today psychotherapy training is very, very similar, regardless of whether you're in training to become a clinical psychologist or a counseling psychologist. You're going to learn how to do cognitive behavior therapies. You're going to learn how to do humanistic, person-centered therapies. You're going to learn a whole bunch of tools to have in your toolbox for delivering good care to your clients based on what their presenting problems are. So what can you do if you are interested in either or both of these areas of clinical and counseling psychology? What can you do with a bachelor's degree? And I will say that this is one of the most common questions I get from prospective students and their parents is, what can you do with that? You can't really do anything, is what I'm told. And that's simply not the case. While a graduate degree is required if you want to call yourself professionally a psychologist and deliver psychotherapy with a license, you do have to have a graduate degree. That said, there are many entry-level kinds of positions where you're working in the helping space, nurturing your interests in clinical and counseling work, but all that's required is a bachelor's degree or perhaps a certification. So one of the areas that's bachelor's degree level is becoming a social or human services assistant. And these are people who occupy a lot of different specific jobs, but they often work in social service sectors, either in the private sector or in government-funded kinds of organizations. So, for instance, you could be a social service worker, a case manager, a social work assistant working in a government-funded state or local county-wide facility. So, I've had students who've done internships basically functioning in this role at treatment provision locations like the Crisis Center in Canton, where they perform a lot of paperwork kinds of work, or sitting in or assisting therapists doing their work side by side. So these are essential workers. They're very important to the work that some of the graduate degree holding therapists have. And the support that they give in terms of providing services, they do a lot of that one-on-one contact with clients who are receiving care of other kinds. What social and human services assistants do is to provide both direct and indirect services to clients. In some cases, they'll be doing intake paperwork, assessing clients' needs, helping them to identify what services they're eligible for, helping connect them to those services, and so on. In the community, human service assistants may work with clients who need counseling, but they're not delivering the counseling. They're providing assistance with other kinds of daily living tasks. So case managers, for instance, we've had some students move on after graduation to work as case managers. At Child and Adolescent, for example, some of the case managers actually do house calls. They come in and work with a client, working on their daily living skills, helping them to organize activities, and so on. In clinical settings, these sorts of individuals will be there to work with patients and clients who are working on elements of their treatment plans, help them with daily living skills, help them communicate more effectively, and so on. Now, these are jobs that, depending on your point of view, they can either seem overwhelming or really, really rewarding. The main area of satisfaction is helping people to access the services that they need and improve their situations. In some cases, though, there are some work environments that have very long hours or atypical hours, such as evenings or weekends. In some organizations that deliver these kinds of services, there can be some chronic understaffing and perhaps the risk of burnout. The median salary in this space is around $38,000, and it varies somewhat depending on whether you're talking state, county, local, government agency, or in a more private setting. But there are options there. In some cases, this is becoming less common though. In some cases, coming in as a case manager or a social service assistant in some organizations, they will invest in their staff and help them to acquire additional training if a person wants to move up. So you come in with your bachelor's degree. Some organizations will provide, as a benefit of employment, access to funds for getting, for instance, a certification or getting a master's degree, so that you can then move up in the organization and provide more sophisticated services. Psychiatric technicians, they're sometimes referred to as mental health technicians. They work with people with mental health conditions, typically in the context where they're in inpatient care or in the outpatient setting where they come in and get services. What psychiatric technicians typically do is things like monitoring how patients are doing. This can be involved in managing medications, so documenting what kind of issues that the person is having with their medications, concerns that they have, side effects that they're experiencing, difficulty accessing their medications. You can think about, when you go to your physician for a checkup or a physical or whatever, there's a person who puts you in the room. That's usually a medical assistant. In the psychiatric environment, that would be a psychiatric technician. Now, their job description is a little more complex than going to your general practitioner and being roomed by an MA. For psych technicians, they're going to also be involved in some therapeutic activities, especially in inpatient environments. So participating in group, helping them with recreational activities. They may be under supervision, distributing medications and other kinds of treatments. They may be involved with intake procedures, discharge procedures, and so on. This can be demanding, but also very rewarding work. Typically, you can enter a psychiatric tech job with an associate's degree, but a bachelor's degree is going to offer you more chances for moving up. But do be aware that, an associate's degree, like a 2-year technical degree, and or a certificate as a psych technician can give you access to this kind of career path. The BA or BS, the bachelor's degree, can give you the opportunity to move up more quickly and to earn more at the outset. On average, so the median annual salary as of 2022 was about $37,000. Psych techs are in high demand because when we, just the percentage of the population that requires inpatient care at some point means that we have more and more need for individuals who provide this day in and day out care to patients in psychiatric settings. Substance abuse counselors, and this is a really interesting space. I have a couple of graduates who work in substance abuse counseling in different capacities. Some are individuals who themselves are in recovery and have chosen to become certified as substance abuse counselors. It's one of the only areas where that word counselor can be used, even though you don't have a counseling license. So being a substance abuse counselor as a profession, as a job, historically, again, just going to drag you back into the way back times, these were individuals who very, very often were people in recovery who know by experience what having an addiction, having a substance use issue is like. They've been through it, they've come out on the other side. So they have direct personal experience, firsthand experience with what their clients are experiencing when they come in to get treatment. Now, not all substance abuse counselors have lived experience with addiction, but many do. So the negotiation was with, licensing agencies and certification agencies at the state level was to say, your lived experience matters. So here's what we'll offer. Most states are moving in the direction of getting a certification as an SA counselor. Many places, though, are starting to really push for individuals to go on and get a master's degree and a license. But the entry-level requirement is an undergraduate degree, typically. Without an advanced degree, though, without a master's degree, it's going to be difficult to move up in an organization. But the substance abuse counselors, the ones with that bachelor's degree experience, they're like the they're the backbone of treatment centers, because they're the ones day in and day out providing rehabilitation services. So if you're an inpatient treatment facility, the people who are going to be doing group, who are going to talk to individuals, who are going to bring them in and talk to them and orient them to their program, who are going to monitor them through the program, and so on. They're doing all of this under supervision, especially if there are other complicated mental health needs for the person who is going through substance abuse treatment. The SA counselors are never going to be completely on their own. They're embedded within a system of other care providers, but they really are the backbone of providing treatment and rehabilitative services. These counselors are often the primary person working with clients. So as I said, backbone. They do evaluations, they develop plans for treatment and recovery, they facilitate group therapy sessions, teach coping, monitor progress, and so on. Counselors can be employed at the bachelor's level with a certification in many states. And I believe Ohio is one of those. This bachelor's level certification involves taking several courses. It's typically, I need to fact check this. It's no more than a year of time. They're relatively, if you compare them with, say, a full-on master's degree in counseling, they're less expensive. They require fewer hours of supervised training. But as you can see here, 300 to 600 hours of supervised training. And what that means is you're working in a treatment facility of some kind, and you're working under supervision of others. So it's very, very hands-on. Certification programs and the exam that you would need to pass to be certified typically comes through the Association for Addiction Professionals. It varies, state to state, what's required and what you need to do in advance of that certification. So it's, depending on what your state you're in, you need to look that up. The median salary for substance abuse counselors as of 2022 was about $49,000. That varies with the specific kind of organization that you're looking at. Is it private? Is it publicly funded? Generally, people are paid more in private facilities than in publicly funded ones, but that's the median salary. The demand is very, very strong. As more and more people are finding themselves really struggling with substance abuse issues. I know there was a spike in demand for these kinds of professionals during, and the need has continued after the pandemic. And as we saw during the peak of the opioid crisis, the need for people with this kind of training is unlikely to diminish anytime soon. And that concludes my coverage of part 1 of chapter 3.